I'm Blackstock from Enhanced Clinic in Sydney, Australia. This video is trying to give anyone a chance that's considering us for surgery to realise something about the philosophy we have and what we do. Now, I'm in no way criticising or deriding any other practitioners or comparing or saying that we provide a better service from anybody from that way, because they can't claim that as well too. I just think it's fair that when people are searching around, that they have an idea how we think about what we do. And now philosophy is twofold. One, that when you cross the line of the theatre, you become the most important person in our lives. The nursing staff, myself, all care about you and want you to get the best outcome. There are separate videos where we go through in great detail about the possibilities of adverse things happening. And we would only do that if we were caring about the outcome. The second philosophy is we want you to become a signpost for our work. So there is no one right way. There's not a single thing. And I say to you that if the only tool in your toolbox is a hammer, everything looks like a nail. So we'll make a lot of efforts to go through, especially with breast, to talk to you about the pros and cons of above and below. Both are great. I've done wonderful above implants, I've done wonderful below implants. And it's about making sure that what you have and what you want, you can get. But we'll outline in diagrammatic form every possibility. Many of the implants you'll see on movie starlets are both above and below implants, and they have great outcomes. We'll also indicate to you how we can make incisions in different areas. We usually go underneath the breast at the crease of the fold, but there are other options and you should know about them. And again, if you particularly want them, we will do it that way. If we can't, or we don't have the expertise, we'll send you to other people who we think could be even better at doing that in that way. We will tell you also that some breasts won't get the look because an implant will still make the breast too low on the chest. Introduces the concept that you may need a lift. Lift is obviously a greater cost, and we'll go through this option. Some women elect to take a two-stage procedure, have an implant, see what it looks like, then decide if they need a lift. A lift will raise the nipple on your chest, but will not give you the fullness at the top. An implant and a lift will. However, much greater cost, much greater time off, issues to deal with, risks and complications. So we'll work with you individually and see what you can get. The decision about silicone and saline. Now, we selectively use Mentor implants because they've been very good, they're a world leader and they have great products and follow-up, but there are other good implant makes. And again, if someone specifically wanted a type of implant, we can approach the company and supply it to you. Silicone versus saline are both very good implants. There are advantages of some, there are disadvantages of some. We'll tell you all about them. Smooth versus textured. Again, there's research that supports one, research that supports the other. We'll guide you through them all. We have all the options. In fact, we do so many cases, in fact we did over 300 last year, that we physically hire a building next door is filled of breast implants so we can have those selections. We can adjust them on the day for you from that side. The position on your chest. Now, some women want them natural, some want closer together, some want a look that people will see, others want a look that they won't see. There's not a single way, it's not a chart, you pick them out and you'll end up. What you start with will dictate what you have. So if you have chest irregularities, if you have differences between your breasts, all these things, others may elect that they can't do because they don't want to, we can do and we'll do them for you. But again, there are some cases that it would be best if we get a second opinion, and we will send you for them so you know the pros and the cons from that way. We often get asked about revisions, treatment of other problems, and we can do those things, but again, you've got to take time, we've got to talk about it in a consult, face to face. We can talk with you through conversations over the net, see you through Skype, pictures, ongoing care can be provided for you out of state. But again, it's a process that's all about caring for you. So the decision to make this short video was just to tell you our philosophy. We do care about you and we want you to get the outcome. We'd like to be doing 1,000 breasts a year because we think that the demand is there if you offer it at the right price. We don't want to be greedy, we want to give you good service and we want to provide it at a cost that we think people can afford. I know it's a little trip to come and see us sometime. We're trying to change that and be closer to areas where people are, but we think it's worth it and we can help you with all that involved in getting here with transport and accommodation. So if you go and get other consultations, in fact we suggest it, consider that it may be worthwhile talking to us at some stage. I hope this helps you.